Now I would like to introduce our moderator, Anaya McLeod, MD candidate. Anaya, you may now have the floor.
Hi, everyone. My name is Anaya McLeod, and like Angelina said, I'm a student here at SUNY Upstate, and this is our panel discussing food insecurity and how COVID-19 pandemic has affected that. So today we have 3 panelists. They're all from different organizations, and they all are responsible for serving different populations, but I think together they're going to give us a really good outline of how the pandemic has had a really detrimental impact on food insecurity and those experiencing it. So our first panelist is Mr. Lewis Clarke. He serves as the Director of Hunger Prevention and Nutrition Assistance Program. Our second panelist is Gayln Stanley. She serves as the Neighborhood Outreach and Food Center Coordinator at University United Methodist Church. And our final panelist is Viens. She serves as the Director of Food and Nutrition Services for the Syracuse City School Districts. For this panel, I'm going to ask them 2 questions first and then allow them to answer, and then we'll take questions from the chat. And so throughout the discussion, feel free to put your questions into the chat. And then for the last 10 minutes, we'll take a Q&A. So to get started, we'll ask our first question. And so this question, I'm going to ask the panelists to answer it in the order of Mr. Clarke, Rachel, and then Galyn. So the first question is, in what ways does your organization assess the effect of COVID-19 on food insecurity? And how would you describe the overall impact that COVID has had on food insecurity? And if you could, so basically, if you could give us a state of play, an assessment, and any relevant statistics that you guys have for your population.
And good afternoon, everybody, and thank you, and I appreciate the invitation. It's a pleasure to be here among this panelists and to speak to all of you out there. I just quickly wanted to first throw out some of the definitions of food insecurity, food insecurity, and in hunger. And just because I want to get that out there as a starting point, and others can chime in as needed, and then I can kind of jump into some of the questions. So food security. For a household, it means access by all members at all times to enough food for an active, healthy life. That's what the definition is, and that comes from the U.S. Department of Agriculture, and that's the definition officially of food security. Food insecurity is a limited or uncertain availability of nutritionally adequate and safe foods, or limited or uncertain ability to acquire acceptable foods in socially acceptable ways. That's food insecurity. So if you don't have enough food, or you have to go and secure food through other ways, including soup kitchens and food pantries, that means you are food insecure, and that'll come into play in more discussion. And hunger is a feeling that can be different for everyone, and food insecurity measures the conditions that can lead to hunger. So oftentimes, when we talk about food security, food insecurity, and hunger, these terms are kind of thrown out there, and I just wanted you to have some of the official definitions so you'd have a background. To talk a little bit about what I do as part of the New York State Department of Health, and we actually try to assist the network of soup kitchens and food pantries and food banks in New York State address food insecurity by providing and supporting their emergency food services. So in New York State, there are 2,600 soup kitchens and food pantries and shelters that are operating. They provide over 220 million meals a year. And we're doing this, all year round. And our job, as far as what my organization does, is to support that network. So the question of, what do we do? How do we help? What are the issues here? The issues really are that food insecurity is really linked to poverty. It's linked to also this system that we have now where there is not a single place where if you have needs where you're food insecure, they can be resolved in one location. So part of that problem is that the typical person who is trying to address the typical food insecure person is using a series of services to help themselves if they have access to them. That includes SNAP, formerly known as food stamps, the Emergency Food Relief Network. They go to soup kitchens and food pantries, or public assistance benefits, several other programs that might be able to help them. But there is no one place that assures that a person who's food insecure can walk away and be food secure when they leave that operation. And so the issues that we are faced with is first access to food and the ability to ensure that people have the information, and the fact that people have to put together between their own income and all these programs and services, an ability to try to make ends meet on in many cases, a day-to-day, month-to-month, or week-to-week basis. So that's really what we're being faced with. And of course, we are also faced with inequities in terms of how services are being provided, access to services across state and neighborhoods, which relates to resources. It relates to how support is, how assistance is provided. It relates to the design of some of these food assistance programs. For example, SNAP does not give you all the resources you need for a month. You're typically, if you're on SNAP or food stamps, you're only going to get 3 weeks at best or less of the food assistance that you need. So you have to find other ways to make ends meet if you are food insecure. And so we put people in a situation where they have to go out and they have to put these resources together. And again, the concern is that we do not have a process that really puts it all together and ensures that people who are food insecure can kind of do one-stop shopping, takes away the negativity of that, and allows them to get food with dignity and through all these operations. So I wanted to, I know that I had 3 minutes, and I didn't want to hog the time, and I wanted to make sure I got to the question. So I just want to be sure that I answered some of the questions, or you wanted to move on to other panelists.
I think you did a great job giving us a great opening, and also giving the population that you serve particularly, and also telling us about the overall impact that COVID has had. So I think it was great, and we can move on to Ms. Murphy.
Right. I just want to make one more statement about COVID. I didn't talk about that. COVID certainly has exacerbated the entire this concern, because it has impacted certainly the lives and the incomes of the people that we're trying to help. And just for some data, I mean, in New York State, probably it's estimated that about 30% to 35% of our 18 million population in New York State has an income at about 185% of poverty or less. And at that income level, you're considered, based on the federal government, to be food insecure. So we have 30% of our population that may be food insecure in this state. And that is impacted by COVID now, which has created more unemployment and more people in need of food assistance. And so COVID has created a big deal. But in addition to that, COVID has also affected all the industries, including the food industries. All those industries and the service workers in particular are unable to provide markets for their products. And the result, of course, is that you have this cascading effect of COVID impacting people who were food insecure, operations that were operating fine, and now creating a level of food insecurity and access to food that has changed. And so I'll let you move on, but there is a significant impact from COVID based on what we're seeing. We're seeing an increase in demand at soup kitchens and food pantries that's at least 30 to 40% compared to pre-COVID. And that's where we are right now. That could continue. Okay, thank you for letting me have a few extra minutes.
Thank you very much. Ms. Murphy?
Good afternoon. So nice to hear about that and hear it from the state perspective. We've done a lot with the state. As already mentioned, my name is Rachel Viens, and I am the Director of Food Nutrition Service for the Syracuse City School District. So at the onset of the pandemic, we really did I think a phenomenal job. We worked with different agencies and municipality in general, from the Syracuse City level, and of course within other organizations who had the tools available for us to do a pretty thorough resource mapping at the onset to evaluate geographical locations of food access points that may be needed. And that was based on, we know the zip codes, we know what the different census tracts shows us and what the poverty rates are in the different census tracts. So we really wanted to look at those particular areas and make sure that it was equitable distribution of food access when we went ahead and launched the grab and go pandemic emergency food program that I've been charged with to run through the school district. And that's simply because it's federally funded, state funding as well does come through with that. And as you know, the pandemic, everybody's sitting maybe not everybody here, because we probably have a lot of essential workers here. So in my hats off and thank you to all of you who are here and what you've done to serve the community. But the children are staying home. They weren't going to school. And because of that, they're not getting breakfast and lunch. In Syracuse, we are a high poverty district. About 80% of our students, we already knew that the data was there. 80% about receive free meals. And that's because they are eligible for free reduced meals through the household income eligibility applications that we send out and look at. And we know that our school system has a very large need. It is only compounded with COVID. So kind of initially, we just did a resource mapping. We knew where we needed to focus, and we did not want to step on anybody's toes. In a time such as this, what you never want to do is duplicate resources, because you don't know how long this is going to go on for. And we want to have a very simple and straightforward way to serve the community, so folks aren't confused about where to go and have resources provided to them. So that's kind of what we did. Moving on throughout the pandemic, I guess to answer the question related to how did we continue to assess the effect of COVID-19 on food insecurity, we really just looked at the numbers. How many folks were coming out and receiving food? Very simply put, if we had 10 people show up and they took 10 meals, we knew we served 10 people. That's not how many we serve. We serve a lot more than that. It's been pretty interesting to see the amount of food flying out of the school buildings. We've had a lot of folks showing up. But as the pandemic, we've had the reopening, and then, kind of like it pushed back the closures. We've seen those numbers wax and wane. So that's kind of how we really assess what we're doing and how it's impacted folks. I'm pretty confident that if you need food, you go get it. You look for a way, you find a way. It might be difficult to navigate that. I understand there's a lot of things involved with getting food. It's not as easy as I'm making it sound. And we could all probably agree and give grace on what I'm saying right now, that food insecurity is a very, very complicated subject. So, but with that being said, I'll say, we know that more people that came, they were coming because they needed to.
Thank you for giving us a perspective from the schools and also just families in general, like people that have the children. So Ms. Galyn, could you go on with that, please?
Sure. Well, let me I work at University United Methodist Church, which is situated on the corner of East Tennessee Street and University Ave. We were just renamed right before COVID hit, because we were joined by Grace Episcopal and Temple Concord, who are on Madison Street. So we went into COVID newly named the Food Center at 324 University Ave, being charged with caring for and supplying emergency food access for the entire southeast quadrant of the city. 2 weeks later, we were charged with being an emergency food access site for the entire city. So we have gone through a lot of very quick changes in this. It's very easy to assess the need right now in COVID, because we are serving right now 300 households arrive at our door every Friday morning. We are what you see on TV. There's a car line going down a mile to a mile and a half. And then we have walkers also that have come on foot, on bike, by Centro, whatever, to gather food boxes from us. We see 60 people every Sunday morning for free to-go breakfast. We cannot let anybody in the church or in the food center, so we are packing boxes through the week, and we work very closely with the Food Bank of Central New York, who delivers food to our site at least 2 times a week. We will get 13 pallets of food early in the week that needs to be unloaded and brought into the basement of the church. And then on Friday during the distribution, our fresh food comes and it sits outside. Fortunately, we're working in an outdoor refrigerator right now, so that works well for us with our dairy boxes and produce, and we just load that into cars or into people's arms or into their grocery carts as they arrive every week. We've seen other changes in our population. We used to just kind of generally say we served the working poor of Syracuse, folks that were retired, disabled. Now we're serving families. A lot of families, a lot of young adults, teenagers who come and collect food for their families. They are, as Rachel said, they're home now, so they can get sent out to food sites to pick up food to bring it home for their families. We see a lot of new Americans also. And a lot of people that have lost their jobs during the pandemic will come to us. So it's a very emotional time in the food line. You're often sitting and waiting in cars where people are kind of coming to terms with their new reality. And it's often very tearful. And we try to work people through that and with respect and dignity, get them what they need to feed themselves and their family. And that obviously makes the anxiety high for everybody involved. So we were working under a lot of police presence at the beginning of the pandemic. We've been able to ask them to move on in the world because things are starting to quiet down. But you know, the extraordinary use of the emergency food system in the city of Syracuse, and I believe across the nation, Mr. Clarke, maybe you can correct me on that, is fracturing an already very delicate system. The system that we use was created in the 1930s during the Great Depression. It's still largely employed in the same fashion, but we have more people accessing it. So it's starting to fall apart, and we see that every week, particularly in the way that the food banks can't get enough food to us. So there's this huge demand. We reach out to our food banks to acquire that demand because, as I said, they're bringing in a dozen pallets worth of food every week. They can't acquire it fast enough to get it back out to us. So it's getting better, but at the beginning of the pandemic, we were having a very hard time securing a lot of proteins and milks, dairy products, and things like that. So it's starting to get better, but it is a broken system. And I have a very successful program. I think that Syracuse, by and large, does very, very well. We have some very strong programs here. But the food chain nationally and federally is a pretty busted system that needs some attention. And it's dated at the very least.
Thank you. Thank you all for all of your answers. And I think what we'll get into later is you all kind of alluded to the different challenges that face the initiatives and the different efforts that are being put in place from all these different organizations. And sometimes when you're on the receiving end, it's easy to see it as frustration, but it's great to hear your perspectives on all the different things that go into play. So I think we can turn to Rachel, the chat monitor, and take a question from the chat, just for the sake of time.
Yes, we have one question in the chat for Ms. Gaylin. It is twofold. Do you get hunger prevention and nutrition assistant program foods through Food Bank of CNY? And also, how many days are you opened?
Yes, we get all sorts of things from the Food Bank of Central New York. They are very, very good to us. They are really working very hard to meet all of our needs. I have gotten every version of every program at any given time through this pandemic. The money and the grants and the food that arrives to us is constantly changing. We strive to offer a very full, nutritionally dense box of food every week. And the food bank works hard with us to make sure that happens. So I'm pretty proud of what goes out. I really believe food is medicine, so I strive to make that happen for our consumers. And all the programs you just mentioned, and there's been some, President Trump put together a box for a minute before election time. We have a lot of local New York State product coming through us. It all has different labels, the farm to families, it all has different titles and stuff, but it's all really great product that we get out to the people as fast as possible. Right now in COVID, we are open Friday mornings, every Friday morning from 10 until 12:30.
And another question from the chat for Rachel. Do you get food from the Food Bank of CNY?
Yes, we do. It's the CFAP funding we particularly utilized, and that has come through different means. I think there's contracts that get put out to the food banks, and then there's some other individuals that could potentially almost function like a food bank and create the boxes and then distribute them to agencies such as a school food authority. So yes, we have gotten those, and it's It's been very well received because we don't have to check who gets them. We can just give them to the community when they come. We don't have to limit it to 18 and under because our programming is geared for children 18 and under. So for sure, we've been using it, and we want it to keep coming.
Great, thank you guys. So we'll move on to the next moderator question. And so this one would be, like we mentioned earlier, you guys mentioned the different challenges, but if you guys could go into that a little more, that would be great. So could you guys give us what you think has been the biggest challenge in the creation and also the success of different efforts and initiatives that you guys have put in place to try to meet the supply and demand, or the increased supply and demand that you've seen on food insecurity during COVID-19? And I will ask that that question is answered in the order of Galyn, Rachel, and then Lewis.
Okay, so from where I am, I see the biggest challenges to be firstly money. I get phone calls from the food bank like I'm out of money every once in a while, and then I have to go apply for another grant and things like that. So the money, I think what is a confusion for a lot of consumers of emergency food systems is that we have to buy the food. The food is not always free. We try to shop for a lot of USDA product, which is part of that has been determined to be our national excess. And that does indeed come to us for free. And then there's some donated product. But by and large, half of our food that we give out is purchased. It's purchased at a wholesale rate, but we still are buying it. So we are blasting through money much faster than we ever have, obviously, before, because we're feeding 4 times the number of people we once were. So that's a huge problem, money, and we rely largely on donations and grants. So, I spend a whole lot of time writing grants all the time. One of the other issues is people power. We need people. This is a high labor, very physical job. We need bodies at the street level that are okay working with the general population and all the bells and whistles that come with that, to unload trucks, to pack food boxes, to serve meals, to get, be outside in the snow and the rain, to be meeting the needs of the people, because we can't have anybody inside anywhere. So it's a real issue to have the strong bodies to do the physical work. And remember, at the beginning of COVID, we had to let go of all our elders. So, everybody 70 years, even 65 years and over, walked off every food pantry, every emergency food site, because if you ever go and look at these places, they're largely humanly powered by retirees. Okay, that's just kind of the nature of it. We have a lot of disabled volunteers that come and work with us. People will join us in supported work situations and things like that. But the minute the parameters came down on how to keep each other safe, those guys had to kind of go home. So we had to reenact, like I'm calling the high schools, I'm bringing my kids in, the kids that came home from college for the summer, that was great too. But the people power is an issue. Another thing that people don't really think about is transportation. We're loading people up with food. And if you have a car, great. A lot of people don't. Centro is okay in the best of times. I hope I didn't offend any Centro people here, but think about being loaded up with like 75 pounds worth of food, which is what we're doing. You're getting on a Centro bus. It's often 2 and 3 bus exchanges to get yourself home. We have seen again and again, and it breaks our heart, that we load people up with food and they're stuck on the corner. Can't go anywhere. Got to call for a ride, get the Medicaid cab. They'll literally hitchhike from the middle of downtown home. We've had people ride their bikes with big banana boxes full of food on the back of their bicycle. So that's a huge problem. Also, Syracuse is a sanctuary city. We have a huge amount of new Americans here, and that's wonderful, but there's a profound amount of illiteracy in English. So we're trying to communicate with people about how to access all of these systems, all the systems that Mr. Clarke spoke about, and the things that are offered at the school district have to be run through with someone that can write and speak English. On the street level, we don't have interpreters. And we have a very hard time communicating with people about how to access all their resources. And what we're being told by the food bank is, indeed, people are not doing all they can do to advocate for good SNAP benefits because it's an unnavigable system. So they come to the pantries and the food centers on the street instead. So that makes us very bottom heavy, and it's a challenge in some.
Thank you so much. You gave a great overview, and I think a lot of the points you brought up will also be addressed from Rachel and Lewis too. So thank you very much for that answer. Miss Rachel?
Yeah, that was phenomenal. It's really interesting hearing that perspective. My biggest thought is that the burden is mostly on the children. We have children who access food during the school day, breakfast, lunch, snack, even supper in some instances, and the additional fresh fruit and vegetable program that we offer during the school day. So these children are receiving upwards of more than 2/3 of their daily nutrient intake through these existing federal nutrition programs. So if you can just picture, all these children now do not have that regular daily access, and now they have to somehow, we communicate with the parents, and then the parents are saying, I have to go to work, or if I can't afford to lose my job. And a lot of those folks are going, we employ a lot of individuals who are already going to be working in the school system, and they're also the parents. And they have become frontline essential workers, and they're doing the most important work at minimum wage. So they are making sure they got to get to work. So we're finding a lot of students are foraging for food. They become gatekeepers of their home. At a very young age. It is a very common scene during the food distribution to have a little guy who's maybe, 7 years old with a big, huge box on his shoulders full of food for his siblings, bringing it back home for the family. And that of course is something where I would say, yes, there's many people who are burdened by the COVID-19 pandemic and the food insecurity that has come with it, which was already pre-existing, but is now compounded. So I would say the children are incredibly vulnerable, and we're doing everything we can to help support them. But that is my biggest, I would say, where I think the biggest weight falls is the children, especially in Syracuse, where we already know there is a problem with food insecurity and poverty and issues with equity.
Great, thank you. And I think it's so great that you're all working within the Syracuse area too, so you guys have information that is able to give us all a real full and complete picture together. Mr. Lewis?
I wanted to say thank you, because that, Galyn and Rachel, that gave us a really good perspective of what it really looks like, what I call boots on the ground. And stepping back, what we really have here is we have an emergency relief network that was designed to work in a manner before COVID hit, where you still at that time did not have enough resources to support the people pre-COVID. And now you have COVID, which has hit, and all of those systems, those programs, school lunch, school breakfast, summer meal, SNAP, WIC, all these programs now are not able to operate even at where they were. And so then you have this network that is attempting to absorb those concerns. This is the safety. This is where people go as a last resort. This is where they end up. And so the issue is the continuation of poverty, the continuation of the pandemic demand. As those things continue, and as our resources, aren't able to support that demand, I see it as a major issue. And I absolutely see the impact on children. I see the impact on low-income communities of Black and Brown, where there are inequities that they were facing before COVID. And now there are competitions for resources, for funding, for all the support that's needed to maintain this network that is struggling to do what it was doing before COVID. So that to me is one of the biggest issues that I do see. And again, that's why looking at the bigger picture, how do we address poverty, looking at stimulus checks, some of these things are going to get people back to a different place. But the other thing is that COVID is going to have a long-term impact. The Emergency Food Relief Network has been, as you said, it dates back to the Depression. And in New York State, it dates back to 1984, when the state of New York decided to create HPNAP, which is when the program was created, because they recognized that food insecurity is a public health problem in New York State. And they decided to put state funding towards this public health problem, which is still a public health problem now, exacerbated by COVID. So my concern is that we have this unknown as to how long COVID is going to be around, the impact, and once COVID is gone, my biggest fear is that there's going to be an assumption that the issues of food insecurity related to COVID will go away. That's not the case. It has a lasting effect. During Superstorm Sandy, those places in Long Island in particular are still not back to where they used to be prior to Superstorm Sandy. Remember that, some of the places in Long Island were underwater. The network, and just talk about the issues. When we talk about food insecurity, we talk about the ability to go get food. We talk about, what's needed and lack of funding, equipment, resources, et cetera. But we also have to make sure that the network itself can stay solvent. During Superstorm Sandy, the network was underwater in some places. During COVID, we had the loss of volunteers, the elderly. We had in the peak of our COVID in April, we had 451 sites of the 2,600 that were closed down completely of the network. And we're monitoring. That's one of the things we do to monitor those sites to make sure. So that's like 20% of the network. We understood that if that number continued to increase, this safety net that we're talking about disappears. So my concern is what happens to the next round of COVID, the next round of this iteration of this disease? Are we going to be in a situation where the resources that are coming in begin to dry up because it's no longer the soup of the day? And we therefore are going to leave a lot of people, no pun included, indicated, but we're going to leave a lot of people stranded because we are not understanding that the impact of COVID is going to be long-term, and the impact of food insecurity in COVID is even longer term. So my concern is just having perspective on this and recognizing that we are now in a place where we have to continue to move forward with a long-term vision and plan, and not with a short-term vision that says we'll be okay once the vaccine hits and everybody, quote unquote, is vaccinated. And that's a thought process and a lot of discussion to what needs to happen to continue to make sure that we can maintain the safety net while people are food insecure, which will be for a while COVID, even after COVID, quote unquote, goes away. Thank you.
Thank you, guys. So we do want to be able to open up to a Q&A, and so we'll ask one more question and then we'll open up to a Q&A. And so if you guys could try to maybe just answer this one quickly, but just following up to the different challenges that you guys posed or suggested are contributing to the difficulty of treating food insecurity. How would you guys say that you alter the initiatives that you guys have created once you were able to get that perspective from the community, or hear that some, like for Rachel, like you mentioned, there's an increase in kids going to retrieve the food, or Galyn, how you mentioned that you have maybe an increase in people having difficulty transporting it. How would you say that information comes into play in you guys is altering how the initiative is being ran? And whoever wants to answer it first can go. Yes, Rachel. Thank you.
Yeah, I'll just start it out. We've heard a few times, and we all know about the toilet paper pandemic. Try to buy 16,000 whole grain rolls for putting into a lunch for children to pick up. There's a big issue with getting things from point A to point B. Our distribution channels are incredibly strained. Because of that, we did go ahead and remodel everything that we do and how we actually serve the families of students when they come. We don't provide, for the most part, we don't really provide single unit things anymore because it was so difficult to find. What we do now is do bulk of items, bulk of distribution, and families show up, they get multiple meal packs for their grab and go. And so, for example, instead of pints of milk, we'll give them the gallons. We'll do things like that, and that's been very, very helpful in how we've navigated, because we weren't having huge issues going out and finding the products. The products are disappearing. They're not available on the procurement channels. So that's something that we've done, and I'm sure other people have done the same thing with different areas of their life and what they've been purchasing.
We've done some similar stuff, moving things. Firstly, we've moved everything outside. As I said, nobody can come into the building. So, but we've had to take, we ran a traditional breakfast program for a very long time, 40 years, I think, where people were coming in and eating breakfast. And that's for our guests who are largely transient, coming out of the shelters, the hospitals, Hutchings, things like that. And they're coming to eat breakfast with us each Sunday. We had to move all that outside. We had to set up a way in which they could access the food quickly without us getting sick or them getting sick from us. So we stood on the corner with a yellow rope around us and had to pack bags early morning, 6 a.m. in the church and bring it all outside. And we were packing little cups with peanut butter and cream cheese and things like that. And we still do that every week. So we were able to find them. We were using Dixie cups for a long time. So, we're trying to make it work, but we haven't. The transportation, as Rachel said, is huge. And it was been a very tough learning process for a lot of our guests to figure out how to get stuff home, and often it doesn't always work as well as it should.
Okay, and I'll also go quickly if I can jump in. So in New York State, we've been involved in trying to increase funding. We've been able to partner with the agriculture market, part of agriculture markets in New York State, through this initiative called Nourish New York, which came from the governor's office, and that was able to allocate or to increase access to New York State products, including fresh produce and vegetables and that kind of thing, and that's been made available. There's also been work to put information out there about the various hotlines. Every food bank has a food locator. There are a couple of hotlines that you can call 211 or 311. We've been trying to publicize those so people, and these are places that you can call that will help you locate where you can get food assistance services as an individual or an organization. So we're trying to put that information out there. There are some food locator maps. There's a couple of different websites that if you check on Department of Health, coronavirus, which begins to point people to the direction that there is a connection between coronavirus and emergency food assistance, and so we want people to be able to utilize those tools so they can get the kind of help that they need. So those are some of the things that we've been trying to push, and also the Department of Health has been pushing what we call the food insecurity screening questions, and they're asking that these questions, particularly for all of you who are going to be in the medical field, become providers, that food insecurity screening questions be asked when you're encountering people who need assistance in other ways. And right now, that's happening. We're trying to push that for COVID contact tracing. We want to ask those questions because we recognize that with the Department of Health COVID contact tracing work that's being done to identify people who have been, to give people assistance who may have been exposed to a person with COVID. Statistically, 30% of the people you may call may be food insecure, and so we're trying to have, as part of that process, those questions asked to determine if, in fact, that person is food insecure, and then refer them to places where they can get food. So these are some of the ways that we are kind of piggybacking and coordinating our services, understanding that COVID and the pursuit of COVID also means there's an opportunity to pursue people who are food insecure. And that would be my takeaway for everybody on the phone, that when you are dealing with COVID or trying to assess a person who might be affected by COVID, there's probably going to be a food insecurity concern somewhere in play that you'll have the opportunity also to pursue. And so this is the message we want you to have out there moving forward. Thank you.
Thank you so much. And now that we're able to hear from the organizational perspective, it's only fitting that we move it to the community now. So we're going to open it up to an audience Q&A. Feel free to use the Zoom function where you raise your hand and you can be asked to ask your question out loud by yourself, or you can submit it into the chat and our chat monitor, Rachel, will read it out loud. And we'll do this for the next 8 minutes. So I ask the panelists to try to go quickly. Thank you.
Okay, we have a couple questions in the chat. First question is for all panelists. How do you address food insecurity at its causes? For example, How do you work to address housing discrimination and how that affects the prevalence and distribution of food insecurity and deserts?
Well, I think as you pointed out, food insecurity relates to poverty, and it has a direct relationship to cost of living, which includes housing, and it includes the price of food itself. And so those are all factors that are involved. You mentioned something, I think you said food deserts, I think in your question. And so, that also, interestingly enough, factors into food insecurity. I'll just jump there for a minute. In the food deserts, you basically don't have access to supermarkets and grocery stores in the community. And that forces people to have to shop in smaller stores, bodegas. And there's something also called the food swamp. And food swamps are places that are inundated with fast food restaurants and small bodegas. And so you have a swamp of all of these smaller stores that don't offer healthier options or choices and have very expensive products in many cases. And people who live in these communities who are faced with a food desert and the food swamp, which you could have at the same time, are navigating, trying to deal with the cost of living, including housing, in addition to trying to buy food at these high prices and in places where the quality of food may be very, very poor. So I think part of what we're trying to do, number one, is the awareness that this is the environment that facilitates food insecurity, and that we have to have that discussion about the root causes of food insecurity, which do go back to poverty, and now it's being exacerbated by COVID, and we have to try to figure out how then to address that. But I will say that obviously, as poverty increases and as the cost of living increases, you're going to have that concern of housing and all the costs increasing. And so it is a question of, how do you control costs so that people can get back on their feet? And, I'll open up to some of the other moderators to see if they have other suggestions or answers in response to that. Oh, the panelists, I meant to say. Thank you.
Thank you. Rachel or Galyn, do either of you have something to add to that?
I guess I just feel like, I agree with everything Mr. Clarke said, but I think that, that was actually like a 3-part question at the very least. So I think that we really need to look at policy and how, our decision makers locally, nationally, federally are making decisions about money and stimulus and long-term. This is, as Mr. Clarke said, a very long-term issue. It's only ever been fragile at best, this system. So we need to not only recover, but we need to make it stronger. So this is such a multi-pieced puzzle that it's hard to just address this is one question. But I think that we really need to look to our policy makers and really make sure that they are addressing the issues that are on the ground that regular people are dealing with, who have to pay their bills week by week by week out of their paychecks instead of out of their investments or whatever rich people do. So I think that, that's really what needs to be happening. And it's a multi-pronged approach.
Thank you. And Ms. Rachel, do you have anything to add?
Not really. I think, this is a loaded question. We didn't even talk about food apartheid. And I just want to say that it's more than just dumping a grocery store in the middle of a food desert. There's so much more to it than that. It's what's in that grocery store. It's the price points of it. It's access for those around. Is it on a bus line? Is it geared for the population that surrounds? There's so much involved in it, and policy has got to be in place. There's got to be laws and regulation in place to protect the individuals who are most impacted by hunger and food insecurity, so that the food access issue can become, it won't be an issue, and it will become part of a healthy community that we create. And that doesn't happen just by one individual. That's architectural design. It's all sorts of things. So that's a really big question, and everybody in the community does play a role in making that happen.
Great. And I guess, Rachel, you can try to ask one more question, and maybe not all panels will be able to get to it, but we'll definitely try if we can go fast.
It is a perfect quick question for Rachel. Do you have the backpack program, and how is that funded?
Thank you for that question. I just want to say before this, we there was always the issue of hunger in the students. We knew that it was going on. I'd often get phone calls from frantic social workers or even parents. High school students even would reach out in confidence and share some things that were happening within their homes, lack of food, lack of resource, etc. And what we did is we did identify the backpack program as it's a national program. It's out of Chicago. Basically, it's not funded by the school district or any government agency. It is self-funded by community members, those who are interested and willing in donating money, donating food, and also donating their time. So what we do is we identify a program coordinator within the community who might be a church, it could be a company, and they basically adopt a school, and they raise money, they raise resources, and they try to create a very comprehensive system so that every week the students who are being identified within the school building as hungry, food insecure, will receive a pack of food to go home with on Friday to get them through till Monday the next week. So we've been doing that for a little bit. We did do it throughout the pandemic as well, because we've been closed so much. That program has kind of morphed a little bit. We didn't just identify specific families for this. We're kind of, when people come to specific sites that already had the funding in place, we're giving it to everybody if funding's there. So, it's been a little bit of both, but it's a phenomenal program. And it's the one way prior to all this, we were trying to put a little Band-Aid on the hunger issue for children.
Well, thank you so much, all of you. Thank you to our panelists. Thank you to our audiences. Thank you for everyone coming together and helping us all better understand food insecurity and the impact from COVID. And so the main session link is in the chat, and that'll take you to the closing remarks and the end of the conference. Thank you, everyone.
Thank you. Bye now.